Bismillahirrahmanirrahim. This video will speak about the severity assessment of community-acquired pneumonia. Community-acquired pneumonia has a wide range of severity, and the assessment of severity enables the most appropriate care to be delivered in the most appropriate clinical settings, and the early identification of patients at risk of death allow early decisions about hospital admission and the possible need for assisted ventilation to be made. And we should point to the poor prognostic factors for severity of CAP. Those with two or more adverse prognostic factors are at high risk of death and should be managed as for severe community-acquired pneumonia. Age equal or more than 65 years. Then coexisting disease including cardiac disease, diabetes, COPD, stroke. Respiratory rate equal or more than 30 per minute. This is one of the most reliable predictors of the disease severity. Confusion, abbreviated mental score, AMTS, below or equal to 8. Blood pressure systole equal or below 90 millimeter mercury, and or diastolic blood pressure below or equal to 60 millimeter mercury. Hypoxemia, respiratory failure with PaO2 below 8 kPa, and the need for assisted ventilation predicts mortality. Urea more than or equal to 7 millimole per liter. Albumin below 35 gram per liter. White blood cells more than 20 or below 4,000 per liter are both predictive. Radiology, bilateral or multi-lobe involvement in patients admitted to ICU. Progression of chest X-ray changes is poor prognostic marker. And the microbiology, positive blood culture, whatever the pathogen isolated. Now we will speak about the CURB 65 score. CURB 65 score stands for confusion, C is confusion. We can measure it by new mental confusion, defined as AMTS below 8. Urea more than 7 millimole per liter. Respiratory rate raised more than or equal to 30 per minute. Blood pressure, systolic blood pressure below 90, and or diastolic blood pressure below or equal to 60. And the age more than 65 stand for age more than or equal to 65. And the presence of CURB 65 factors correlates with the mortality as follows. 3 to 5 factors present gives a mortality of 15 to 40%, and 2 factors gives mortality of 9%, and 1 factors 2.1%, and 1.2% in the presence of no factors. Low risk of death if the age is below 50 and no coexisting disease, and the CURB score 65 score is 0 to 1. And those patients may be treated at home. Curve 65 may be used by general practitioners in the community to help assess patients, and the score of 0 suggests patients with a low risk death who may be appropriately treated in the community, and the score more than or equal to 1 should be considered for hospital admission. Pneumonia severity scores aim to contribute to rather than supersede a clinical judgment. They include a potential overemphasis on age. There's another important score which is AM, AMTS, which stands for abbreviated mental score, and there is 1 point per question and the maximum 10. Includes the following: age, date of birth, time, year, hospital name, recognition of two people, recall address, date of First World War, and name of monarch, and count backs 20 to 1. We'll ask the patient to answer any of the above questions. Then we'll give 1 point per question and the maximum will be 10. Abbreviate mental score below 8 or equal to 8 is considered as confusion.